Hi, everybody. This is Don Berwick, President Emeritus and Senior Fellow at the Institute for Healthcare Improvement here in the United States. But I'm joining you because I have a long-standing relationship with Wales and happily with the Bevan Commission and the terrific work that's gone on in NHS Wales. I feel very privileged to have been part of your journey, a small part, now for well over a decade. COVID-19 has stressed us all, physically, emotionally, psychologically, economically, socially. We're learning as we go, but the tunnel seems very long, and there is also so much uncertainty. How long will this last? Who will be harmed? What should be changed? In a crisis this big, it's very easy to become disoriented, even to lose hope. The stress on the healthcare workforce is easily visible to us all, and it's very, very costly. And so what are we going to do? When you're feeling lost, you look for a map, some framework that can help you get reoriented, to find a sense of direction. I remember when I was in training, I was a very young doctor. It was late at night. I was admitting to hospital a very sick woman. She had diabetic ketoacidosis, I remember, and she had many, many complications. And I, as a young doctor in the first stages of my work, I was overwhelmed. Frankly, I went into a back room in that hospital ward and I started to cry. And then came my senior resident supervisor, the registrar, John. He had been where I was. He knew what I was feeling, and he knew what to do. He put his hand on my shoulder, and he sat down, and he said, "Okay, Don, let's make a plan." And he pulled out a sheet of paper, and we wrote down categories, I remember: airway protection, blood pressure support, blood sugar control, managing acidosis, potassium, and so on. We broke the problem into pieces, and the map took shape, and so did a plan. Within maybe 20 minutes, I was back in action. Step by step, I had a pattern in hand. The world was starting to make sense again. That patient recovered, and so did I. Wales is a wonderful nation. I love my visits with you, and I look forward to many more as soon as this pandemic allows us to. Wales has a history and it has a culture to build on in the face of any threat, even one as big as the pandemic. You in Wales, you know how to act in solidarity, and even more important, you care about each other. It's evident to any visitor. You know you are interdependent. You welcome that interdependency. One manifestation of that priceless cultural strength is your National Health Service. It's never perfect. It's always facing challenges, but it is, I think, embraced and valued by your whole people. So now here's COVID-19. What's the plan? Where's the map? Now, no fixed plan, no single map will do. This pandemic, it's too new, it's too dynamic for that. Wales, like the rest of us, is going to have to manage back to health step by step. You'll have to learn as you go. But actually, you do have a plan. It's a plan of enormous value. And I think it's capable of getting you a long way home. It's called Prudent Healthcare, as you know, and it comes from years of good, solid work catalyzed by the Bevan Commission and embraced by others. As I've told my Bevan Commission colleagues and my NHS Wales colleagues many, many times, I think that the Prudent Healthcare Framework is one of the most powerful and capacious guides for healthcare reform that I have seen in decades of work on healthcare improvement. It's a simple, elegant formulation. It's full of space for adaptation, for innovation at every level, from national to local health boards, to hospitals and clinics, even to individual care, even to an individual consultation room. Now, as you know, I'm sure, prudent healthcare has four main elements. First, public and professionals are equal partners through co-production of care, element number one. Element number two is care for those with the greatest need get the care first, element number two. Element number three, do only what is needed and do no harm. And element number four is reduce inappropriate variation through evidence-based approaches. That's it, co-production, attend to the needs of those in the greatest need first, do only what is needed and do no harm, and use evidence. Now, I will tell you, if Wales or any nation adhered to those four principles every step of the way, in the design, the conduct, the financing, the measurement, the support, the activities of its healthcare system, it would take giant steps toward what we in the Institute for Healthcare Improvement, IHI, call the triple aim. The wonderful idea of my colleagues John Whittington and Tom Nolan, IHI faculty back in 2006, the triple aim. That means pursuing better care for individuals, better health for populations, and lower cost through lower levels of waste. As a bonus, by the way, pride and joy in work would rise for the entire healthcare workforce. Let's think about the COVID-19 pandemic with the help of the map of prudent healthcare. Prudent principle number one, co-production. Absolutely. Ending this pandemic cannot be delivered by the NHS alone or by clinicians alone, nor can it be delivered by the public alone. This is going to require public health in every sense of that term. Masks, immunizations, social distancing, trusts in care management, supports to hospitals for the very ill, supports for the stressed workforce, expanding the whole notion of the workforce to include many, many sectors of the economy and many job descriptions that I think before we might not have thought of as the healthcare workforce. This is going to take everyone all together. Everyone's going to have to do his or her part. The end of the pandemic will be co-produced, or it will be hard to produce it at all. Prudent principle number one, co-production, yes. Prudent principle number two, attend to those in greatest need first. Yes, COVID-19 threatens everybody, but its main attacks are selective. Elders, people in institutional settings, communities of color, communities at economic disadvantage, the incarcerated, the lonely, those with multiple chronic illnesses. The proper strategic attack on this virus is exactly to protect first those whom it harms first. COVID-19 forces our attention to the excluded, to the marginalized, to the vulnerable. And so begin there. And that, by the way, ought to be the strategic plan for all time and long after the pandemic has left us. Prudent principle number two, attend to those in greatest need first. Yes. Prudent principle number three, do only what is needed and do no harm. This is essential in this pandemic. The resources of care are being stretched to the breaking point, and we just don't have the time or the treasure to waste. This is the moment when healthcare and the public must ask together, in trust, what truly adds value to our health and our lives and what does not. Every ounce of energy has to be focused where it can help. This involves innovation as well. After decades of playing at the edges of virtual healthcare, for example, the modern use of the modern digital world, healthcare has plunged headfirst into the virtual care world. And much of it anyway, we can, if we wish, we can keep. We can provide better access more quickly at far lower cost to everyone. Expertise can reach now and in the future where it never has been able to reach before. And we have to do all of that safely. We have to keep our wits about us, our eyes open. And so harnessing science is going to matter. Prudent principle number three, do only what is needed and do not harm. Yes. And then finally, prudent principle number four, use evidence, use science to reduce unwise, unhelpful, and unwarranted variation in care. COVID demands evidence-based care, demands that we honor the science. We are learning at a rate that is unprecedented in my entire career. What works? What does not work? How do we know? Who has made a breakthrough in care that we all should know about and emulate? This pandemic has suddenly made us a learning world with lessons that are spinning around us, ready to grab, ready to use if we will. In managing this virus, best practices are emerging. The commitment to use them quickly and reliably needs to be total. And equally, myths and nonsense and unscientific thinking have no place among us. That applies both to physical care and behavioral health care and to spiritual and emotional support. We should do what works. Evidence-based care, absolutely yes. So, prudent healthcare, my friends, is not just a clever poster. It's not just a set of slogans. It's a guidebook to success. Each profession and each place, each location, has a chance to take those 4 strong pillars and build under them the local images that are going to fit you locally. You can make prudent healthcare your own, and you will benefit from it. I think you will find no better framework for the changes that will get us through this awful moment and make this pandemic history and make the future even better than the past ever was. So Wales, you can do this. Your culture, your history, your solidarity, your love for each other, these are the fuel for your journey. And the prudent healthcare principles are a map for that journey. Thank you. I hope we'll stay in close touch, and I wish you all very well.